Welcome everyone to this webinar. This is the second webinar in Starlight's Play in Healthcare Week series. My name's May. I'm going to be just top and tailing the webinar today. I'm the Insight and Impact Manager here at Starlight. So this webinar is all about a new award which Starlight launched this year. It's called the Health Play Innovation Award. And today I'm really excited to say we're joined by the winner and the 3 runners-up of the 2025 award. So today is really an opportunity for the winner and the runners-up to talk about their amazing innovative work, kind of showcase what they've been up to, and hopefully inspire some of the audience to be innovative in your practice too. So I'll just run through what the sort of agenda is today. This is a sort of running order. I will speak briefly about what the Health Play Innovation Award is. We'll then ask Tracy Martin, who is the winner of the award this year, to present about her innovation. We will follow Tracy's presentation with a short question and answer session for anyone who has any questions for Tracy. That's because Tracy has to dash off for another presentation. So we'll just hold a quick Q&A there. Then we'll move on to hear from our 3 runners-up. So we've got the Dinky Beats team from Leeds Children's Hospital, Zoe Keats from Royal National Orthopaedic Hospital, and Hope House and T. Gabaith Hospice team. So I'll let them all introduce themselves a little bit more in their section. And then we'll also have time for some questions for any of the runners-up as well. So, and then we'll finish with a quick reminder of the next Starlight webinar that's coming up. I'm joined today by Sandy and Hannah from Starlight, who are going to help to facilitate this webinar for me. So thanks very much to them. So I will just speak for a couple of minutes about why we introduced this award and what kind of applications we were looking for. So through our everyday work at Starlight, whether that's through speaking directly with health play professionals as well as other healthcare professionals, we hear feedback about our services. We also speak directly to children and young people. Through all of that work, we know that health professionals can be really inventive, resourceful and creative in the way that they overcome challenges in their settings. And often we hear that the way that they are creative is by delivering play in a really novel or innovative way. So we really wanted to introduce an award that recognises and celebrates these innovations and, of course, the people behind those ideas. And we really wanted to kind of provide a platform, raise awareness, elevate this work, and also inspire innovative practice among the sector and try and build that space within the sector. In terms of what sort of applications we were looking for, this is kind of how we think about Starlight, how we think about innovation at Starlight. So it kind of starts with defining the problem. So having a really deep understanding of some of the challenges that children and young people face in healthcare, or some of the challenges that health professionals face when delivering that care. Then the second stage is around ideating solutions. So and you won't be surprised to hear that what Starlight advocates for and what we know can be really effective is using play to overcome some of those challenges and using play as the solution. And then importantly, that third phase, delivery and evaluation, we wanted applicants to have actually tried out this work in their setting, tested something new, see if it works, and were able to show us the impact that it had on children and young people. So this is really the stage that we wanted applicants to be at when they were applying for this award. And you'll see today from all of the speakers, the winner and the runners-up, that they were really able to demonstrate some amazing evidence that showed us the impact of their work. So that's a little bit about the award, just to set the scene. But I think over now to our winner of the 2025 Health Play Innovation Award, who is Tracy Martin from Leeds Children's Hospital. I'll let her introduce herself, but yeah, over to you, Tracy.
Thank you. Yeah, hi, I'm Tracy, and I'm a play specialist who now works within the psychology department at Leeds Children's Hospital. And that put me in a great position to develop this work, which has been a labour of love for the last 10 years, but I've never really had the full time and support to do it properly. But now that I'm in psychology, I've had dedicated time to develop it. So the VIP Pass scheme launched last June in 2024. So the main
Oh, you
next
accidentally
slide,
popped
please.
yourself on mute
I
there.
tried to change the slide myself. I'm sorry.
Don't worry.
So anyway, so the challenges that we had really were that a lot of play staff were working with children who had procedural anxieties, whether it was on the wards or whether it was somebody with a really severe and complex one that was referred to psychology. And they might have, lots of sessions, play-based sessions to desensitize and prepare them for procedures and to give them coping techniques and able to, you know, be happy to go off and say, right, I can manage a blood test now. But the problem was, these were the challenges. You could send them off, but it wasn't working properly because of all these issues. So basically, medical staff would approach a patient and they wouldn't know that that patient already struggled. Even if you'd written a plan and told the patient and the mum or dad to carry the plan with them, they might not always have it when they went to a hospital. So it was trying to think of something that meant that everybody would know when the child came to hospital that they struggled with medical procedures. So also patients who had received therapy and were coping quite well with the procedural anxiety were then regressing because they had a further bad experience. I think it's quite timely to mention Starlight's causes of trauma report as well, because that's just great. I'm mentioning that in my next presentation because it's just so relevant to this. So also junior staff were possibly having multiple attempts on patients with pre-existing traumas, and I wanted to make sure that if a child had a pre-existing trauma and was quite sensitive and at risk of being re-traumatized, then really they needed to have the most experienced clinician available to do that procedure on them. Staff were unaware of any existing procedure plans or the patient. Sorry, I can hear somebody else talking. Do you need to mute? Thank you. Staff were unaware of any existing procedure plans or the patient's preferences or reasonable adjustments, unless the patient turned up with it. Yeah, and then also there were inconsistencies in the level of support for anxious patients, leading to a lack of trust in medical staff again with the children. So if they turned up expecting a procedure to go how they wanted it to go according to their plan, and then they didn't have a member of staff that was particularly supportive or knowing how to approach that child, then that would then make, knock the child's confidence so that the next procedure again would be a problem. And then patients with severe procedural anxieties were unable to access vital treatments and procedures. So that's basically that we would have some children and young people that had such a severe procedural anxiety that they couldn't start a treatment, say for, like injections for growth hormone or dermatology injections or rheumatology injections, anything like that, because they were so scared of the blood tests that were associated with it. So they couldn't actually start that treatment. That's just an example of how it would affect that. So that just shows all the different ways, really, that even though they had a plan, there were still lots of challenges. And I think that was because of staff awareness, really. So it's not just been, a fact of just putting the VIP pass in place. There's been a big challenge with staff awareness as well. Can I have the next slide, please? So when they put on the scheme, this is what they receive. So this is what the badge actually looks like. They can wear it around the neck on the lanyard if they want to. If they want to be a bit more discreet, they can put the card in the pocket and not bother with the lanyard. It says clearly on the back that they're on the procedural anxiety scheme and not to attempt any procedures without reading a copy of their plan. And there's a QR code on there to scan as well, so that if they were to go to a different hospital that didn't know the scheme, then the member of staff could just scan it with the mobile phone, and it links to a website that explains the scheme and why it's important. So they receive the VIP pass and lanyard, and then they get the personal procedure care plan, which I'm sure everybody's used to writing those kind of care plans that say things, personal preferences on there, like where they want to sit, whether they want cream, cold spray, what distraction they want, all those kind of things are on the care plan. That's written with the children during the therapeutic one-to-one sessions, where we are doing the play preparation and they're playing it out first on a teddy or a doll, and then we work right up into where they can have the procedure played out on them. A full behavioural rehearsal. So as well as having a plan, a copy of the plan to carry, the plan actually goes onto our electronic patient record system, which here at Leeds we use the PPM Plus, and I know everybody all over the country has different systems. But on that system, it took a very long time, but we managed to get an alert put on now, so that as soon as anybody signs onto that patient's record, it does come up an alert that they have a procedural anxiety VIP pass, and don't do any procedures until you've read the plan. Can I have the next slide, please? So yes, I was talking about staff awareness. That's a massive part of it. So we've done all sorts of things through the comms team, and we've done PC screensavers, posters, obviously lots of presentations and service development meetings. I'm going to another presentation after this at the Grand Round. And as a result of the staff awareness, we've also managed to get new bookable VIP phlebotomy appointments. They only offer 2 sessions a week, but that's quite good because we do only actually have 35 members. It sounds as though it would be a massive club, but there's only 35 members that have a VIP pass. So that's quite manageable really on the 2 days. And there is a strict eligibility criteria for patients to be added to the VIP pass, and it is only registered and qualified health play specialists and clinical psychologists who are allowed to write the plans and place a patient on the VIP scheme. We've got the SOPs and guidelines for all the users, loads of different ones on how to add the alert, how to write the plans, the eligibility to make sure they're eligible, all those kind of things. We've talked about the QR code as well on the back, and we did a service evaluation in May, which was to evaluate the first year of running it throughout the entire hospital. So when I go on to the next slide, but not yet, when I go on to the next slide, it's a lovely, I'm obviously not going to share all the evaluation because I don't have time, but it is a lovely example. It's describing the feelings that they were asked to express before they were given a VIP pass, and then their feelings after, since they've been on the scheme. So we can look at that next slide. Thank you. So you can see that the ones in red were the feelings before they were given a VIP pass, and they're all very negative feelings and a lot of anxiety and worry on there. And then the ones in green are the feelings afterwards. And even though you can see that they're still worried and anxious and scared, which a lot of children with a severe anxiety will still have all those emotions, the bigger emotions now are that they're listened to, they're reassured, and they're in control, which I think is fab. Next slide, please. This is just a bit of service evaluation feedback quote that I'll let you read for yourselves, really, that somebody did. I think that's a nice positive one. Obviously, there were lots of quotes as well. We've got lots of positive ones and some constructive ones as well. Next slide, please. So yeah, just to finish off, this it really is the benefits it's had for the patients and staff and everybody really in the trust. So the patient trust in staff is key to the success of procedures, and the plan gives the patient and family confidence that their wishes will be respected. The staff have a plan to follow, so that makes it easier for them to arrange and carry out procedures. So not all children are going to be able to manage procedures even though they've got a VIP pass, because as I say, they are the really extreme patients that we have. So some of them might require sedation and they might still require holding, but at least the staff and the family know that that is the plan and that is what is going to happen. And so they're able to arrange procedures despite those difficulties, because it's all written down for them. And staff are prepared and aware of the patient's needs before they meet them. There's fewer unsuccessful or refused procedures. And phlebotomy staff say that they are learning techniques by working with us that they can apply to all their patients now, not just the VIP ones, which is fab as well. And there's a greater general awareness of procedural anxiety throughout the staff. Next slide, please. I think that's it. Oh no, just a bit more feedback. Yeah, this was not from the actual evaluation, but this was the feedback I got for entering the Innovation Award. And that's it. And that's me getting my award off Kathy. Thank you. Any questions?
Yeah, thank you so much, Tracy. A great presentation of your work, of how you've taken it from an idea, implemented it, tested it, evaluated it with such amazing feedback as well. So yeah, I did want to open the floor. If anyone has any questions, pop them in the chat, or feel free to raise your sort of virtual hand and we'll see you on Teams. But yeah, any thoughts, questions, reflections for Tracy? I'll come to you, Sarah.
I just wanted to say it was amazing. I think that's so fantastic. Having worked in a hospital and now in a hospice, to know that that's actually happening. We used to have like the hospital passports, and we at the hospice find it's really difficult to be able to explain to other professionals that might come in how some of our children find anxieties, and actually because of a lot of our children have PMLD, how to get through to them. Have you ever worked with any children with PMLD that suffer with anxiety, and do you think this would be the sort of thing that would be able to help?
I'm sure it would, yes. I mean it helps any of them really, if they've got a firm plan of how they want it to happen, and they've had a say, like it said in that last feedback, they've had a say in how they want it to happen, and it does just give them that confidence that people are listening to them and that this is how it's going to happen. So no matter
it helps the
what
parents
child
as
it
well,
is, yeah, the parents definitely, they feel reassured as well. Yeah. I mean, one of the questions was in the evaluation, who do you think it helps? Parents, patient, or the staff? And it was, across the board that everybody thought it helped everybody.
I just think it's absolutely wonderful and well done. I think it would be amazing if that was across all hospitals. And how long did it actually take you to get that in place? How many years of slog to get them to listen?
Yes. Yeah, well, as I say, I did start a pilot, that was in 2014, but it started to take off. It leaked onto social media, and I just started getting all these emails, and I was working on a ward, and I just didn't have the time really, and so it's had to go on a bit of a back burner until I was in the right place, but then and had the time to do it. But I'm just so glad that we've persisted, and I've had people like Lisa behind me saying, you can't let this go, you've got to keep doing it, it's really important, and it is. I'm so glad that we've done it, and I hope that it does go national. Hopefully I've got plans to do that, but one of the main issues will be getting around all the different electronic patient record systems that everybody's got, really.
That was going to be my other question. So for us, because we're on the Shropshire-Wales border, we have one set of note system for England and our counties here, and then a completely different one in Wales. So it's how you'd cross that, because there's no same. You'd think the NHS by now would have one.
Yeah, you would.
Just one thing.
Yeah.
But I just want to say congratulations. I think that's absolutely fabulous. Well done.
No, thank you so much.
Great. Thanks, Sarah, for your question there. I'm going to come to Lisa. We've probably got time for Lisa's question.
Thank you. So I just want to say well done, Tracy. Obviously, I'm very honoured and privileged to work in the next office to Tracy and be part of the FAB team and see the work she does each and every day. I know Tracy touched on it, but I think, you know, a situation we had a couple of weeks ago, we must also stress the importance of how this helps professionals. So, you know, your junior doctors, your CNS nurses, your phlebotomists, etc. I had a doctor say something the other day. It was a child that was just going into our CAT unit. And obviously they were very anxious about doing this complex child, but obviously we were able to see the flag on PPN and follow the obviously plan to the letter in an acute area, obviously, that the child had presented. So I just wanted to say, you know, we must not forget how this is helping the professionals and also raising our profile as well. So well done again, Tracy. Thank you.
Oh, that's lovely feedback. Thank you, Lisa. That's good to hear. I tend to only hear the negative ones where it's not worked. But yeah, that's fantastic. Thank you.
Brilliant. Thank you, Lisa. I can see we've got a bit of a conversation in the chat going on as well about kind of scannable QR codes in other settings. I definitely encourage the conversation to keep going on the chat. I'm going to have to move us on, I'm afraid, just so we have enough time for other presentations. But please, if you do have any other questions, just pop them in the chat. Tracy, if you do need to also go to your other presentation, then please do. But thank you so much for your presentation today, and a big congratulations again.
Thank you. Can I just answer cases? I've just seen about if the QR code could take them to their actual plan. That's what I originally wanted, but we're not allowed to do that because of information governance.
Mm-hmm.
Yeah.
Great.
Thank you.
Thanks very much, Tracy.
Okay, thank you. Bye-bye.
Again. Thank you. Great. Okay, well, we will move on to one of our runners-up in no particular order. We're going through these runners-up, but we now have the Dinky Beats team from Leeds Children's Hospital, and I believe we have Caroline, Megan and Abby on the call to talk us through it. So over to you guys.
I'll go first, seeing my name's first. Well, it's not on there, but it was on the other one. So I'm Caroline. I'm one of the children's diabetes nurses.
Hiya, so I'm Megan, so I'm the play specialist for the diabetes team. And then we should have Abby in here as well. So we're here today just to talk about Dinky Beats. So we're using it as a bit of, our title at the moment is a sprinkle of play in the world of diabetes. So if we go on to the next slide, the kind of when coming across and thinking about what we could do to be innovative in kind of our setting, we thought about the challenges that we're faced by the youngest cohort of our patients, and that's kind of our under sevens cohort, that early years, the really tricky cohort. So we noticed that there was a larger number of young children being diagnosed, and we kind of thought, well, you know, that's okay, but how do we support these children? So if you go on to the next slide, we kind of had a thought about some of the challenges that were coming up and coming up again and again. So that was about communication, about starting school and nursery, lots of changes in their environment, lots of dependence on caregivers, and also the appropriate mobile phone access that comes along with using some of the diabetes technology that we have. But then we noticed that actually with these challenges came their own challenges. And so if you go on to the next slide, we kind of came up with even more challenges. And so it just became kind of this big spiral of challenges that we thought we need to do something to kind of support and make sure that these people are getting the best support that they can. Oh, I think that's Abby that's just come in. So if we go on to the next slide. So how did we start the process? So we initially talked to our families, because at the end of the day, it's the children that are at the centre of this, and it's the children that we need to support. So we did a survey out to all of our patients that were in the age appropriate cohort, and 83% of them said that they were really interested in having a dedicated clinic that would support them for this age and for their diabetes care. 88% of them wanted to play with children of a similar age. They wanted to spend extra time at clinic, more than they typically would. They wanted access to the full team, so that would be psychology, play, nurses, doctors, dietitian. They also wanted procedural preparation, practicing skills on teddies, play around diabetes, also play not around diabetes, and some emotional wellbeing resources. So instantly we kind of had a little thought about what we could do. And if you just go on to the next slide, this is how Dinky Beats Clinic was created. So you can just see some pictures here that kind of show a little snapshot of some of the loveliness that happens during Dinky Beats. We have about 40 families that access Dinky Beats at the moment, and they are all kind of children, and we also open it up to their siblings as well to come and learn about diabetes. So if you just pop on to the next slide. So the dinky details. So why? Obviously, I don't need to preach to the converted. You know, we all know that children have a right to play. We all know they need to be in a safe and stimulating environment. And we all know that children learn through play. So we thought, how can we put play into the world of diabetes? So we decided on quarterly themed play. We decided on having a little bit of messy play, a bit of medical play, and a bit of story time. We then looked at how families could help other families and added in the element of peer support, informal education about diabetes. We have snacks and drinks to make sure that the children are knowing that they're not alone in having to wait for food and some of those challenges that kept on coming up and up. And then the opportunity for children to stay and play and just to learn through play and to have the play available to them. So how? Probably thinking we need space, we need people, we need time. So we're very lucky in the Diabetes Centre at Leeds Children's Hospital that we have a meeting room that we use. So we already had our space. We have the team there that's ready and raring to go. So we've got the play specialist, nurses, doctors, dietitians, and psychology as well. We think about the families that are coming in to see us. And so we did considerate scheduling to make sure that families who had the same first language would come together, or families that had been diagnosed around the same amount of time would come together. We have a nurse that's available to support for any medical needs, so the parents can step away and go and speak to the doctor. And we also have consideration of developmentally appropriate activities to make sure that each child is being treated as an individual, not just as a child that has diabetes and we're going to shove them all in the room together. Kind of we look at what the interests are of each child. So the next slide is the impact. So the first main impact that we came across was the power of the normalising the medical play and the importance of shared experience. So you can see in these pictures, these children are playing together. They're using real diabetes medical equipment, but they're also just playing. They're giving each other injections. They're playing doctors. They're living out their experiences. And actually that was really powerful for us to see as a team. And it actually changed the way that we interacted with the children as well. So if we go on to the next slide, we have an example of this, and I'm going to pass over to Caroline to share these examples.
Thank you. So this is the real sort of importance of why play is so important. So here we've got two lovely young people who one of them was struggling with the cannula change. So the importance of moving sites when you are giving insulin is really important, because obviously if you give insulin in the same site, it can become lumpy, and obviously then your diabetes control can be challenging. So this young person was introduced to another person with a similar insulin pump, shared experiences, normalizing feelings that obviously it is scary when something needs to happen and something needs to change. So we did some playing, we placed a cannula on the teddy, and that led to this young man being able to change his cannula in a different place whilst he was in clinic, whilst being supported by the other young person. And the outcome of that medical outcome was that actually we didn't change any insulin requirements, but there was an improvement in his overall control, which was sustained, and that's just the impact of sharing experiences. Next slide, please. Another experience is also with parents, between how powerful peer support is. So a mother of a 4-year-old girl who was diagnosed at the age of 2.5. English was mum's second language, and mum was also the main diabetes carer. She was obviously striving for perfection, which obviously led to a significant diabetes burden and obviously high stress. That she was able to connect with another parent in clinic. They also shared experiences on top tips and the challenges, and it's also, so it helps to normalize the feelings that obviously things can be tricky. Mum was able to attend clinic whilst her child stayed outside and played, and this enabled her to share her feelings and obviously further gain support from her psychology. And that just doesn't always happen if you've got a small person in clinic with you, because it becomes challenging and parents don't want to show that they're upset, show that things are difficult in front of their small child. Next slide, please. And this is just some of the medical impact following our Dinky Beats clinic. So obviously it was set up in back in 2023, and this is obviously a measure of diabetes outcomes of what we use in our diabetes clinic. So you can just see that the overall reduction in HbA1c has had a huge significance, and it has continued to improve. So the August data is at the bottom, and again that's improved even more with the reduction of the orange section has now been reduced as well. And the long-term improvement of diabetes care obviously reduces the long-term risk of issues with diabetes in the longer term. So it has a huge impact. Next slide, please. And I'm going to hand over to Abby.
Yeah, I was having some techie issues before, but they've resolved. So hopefully you can all hear me okay. So the impact on emotional well-being, so we captured this by doing a very simple questionnaire with children, which was kind of different emoji faces and different aspects of their life. So thinking about diabetes, school, family, and themselves. And there was, so children diagnosed more than a year, there was a 60% improvement in how they felt about their diabetes. And in the first year of care, there was also a 60% improvement, or either 60% improvement or no change in how they felt about diabetes, which I think is quite normal, because I think it does take time to kind of adjust to the condition. So amongst parents, we do a more kind of detailed questionnaire, which is structured around kind of managing emotions, daily activities, family, and interactions with friends and other healthcare, the healthcare team as a whole. We found that sort of at baseline, the biggest negative impact of kind of coming to terms with the diagnosis was kind of impact on emotions and daily activities. And at a year follow-up, there was improvements in kind of emotional well-being, interactions with friends and others. And what was really helpful was like the positive relationship with the healthcare team was maintained. Next slide, please. So these are some reflections from our MDT staff. So everybody kind of shares that it, you know, watching the children play, share stories, making like diabetes friends is just such a lovely experience to be a part of. Getting to know the children and the families better. We have a lot more time to just kind of talk to families, get to know what their experiences are. Watching parents connect and share top tips is always really powerful. Normalizing the ups and downs of living with diabetes, and normalizing the role of psychology as well, because sometimes people can have certain perceptions of us, and it's nice to kind of just be able to meet families and try to normalize that. Peer support is a really great thing about the clinic. So families meeting each other, opportunistic teaching. So we had a good example of that with like young people comparing pumps and maybe kind of tips of how to cope with like pump changes more effectively. But yeah, just overall, it's a joy to be a part of. And we've had some lovely feedback from families that they've benefited from the clinic, and it's a more fun and interesting experience for them. Next slide, please. So we've got a video here, which hopefully we'll be able to watch.
Oh, sorry, I didn't know if that was the end or if you had another slide.
We do have another slide, but I can just put it on briefly. So I'll just leave this up. I know we've slightly run over, but this was a poem that one of our play staff members that was covering Megan on mat leave wrote, which is just a lovely kind of sentiment about how every young person with diabetes is different. So I'll leave that up on the screen.
That's brilliant. Thank you very much to the Dinky Beats team. We'll leave that up as I just move on to the next person. So we will now welcome, I think it's Zoe Keats from the Royal National Orthopaedic Hospital. And we are running a little bit short on time, so over to you, Zoe. Any questions, please pop them in the chat.
Hi everyone. Thank you very much, May, for introducing me. My name is Zoe. I'm Senior Play Specialist at the RNOH in Stanmore. I was dead excited to win an award with Starlight this year. And I'm going to tell you all about my invention. So next slide, please. Okay, so my innovation project is an MRI scanner, a 3D printed MRI scanner to help children to have MRI scans awake rather than going off to sleep. So I've worked at the hospital now for 19 years. I've just celebrated my 19th year. And when I first joined the RNOH, I used to work on a Saturday morning. We used to have MRI GA clinics on a Saturday morning. And we could have like up to 6 or 7 or even 8 children on the list on a particular Saturday. And most of the children who came in on those Saturdays were under the age of 12, so from the ages of 3 to 12 actually. And I really wanted to try and kind of put a stop to this and try and see, well, why can't we, you know, prepare children using you know, a tool to help them manage it awake first of all. So that's what I did. And there was a 6-year-old boy who needed a scan urgently on one particular day, and he was booked on the GA list, but unfortunately he had a high temperature, so he couldn't go for one under GA. So I was asked by the anaesthetist, would you be able to you know, try and help him to do it awake? And I think that's on the next slide actually. Can I have the next slide please? Oh no, sorry, I will let me talk about these first, and then I will finish talking about the case study. So basically what I've done is I've made 5 scanners now, and it started with the blue one on the left hand side, and then the second and third and the fourth one. Unfortunately, the fourth one hasn't worked because we got it printed in this very strange color, and it didn't do what we wanted it to do. So the 5th one model that we've got now is white again, and it's got the lettering, my logo, on the front of it, and it's now got the lights, it's got moving bed, it's got a remote control, sounds come through it and everything, and it's very much more realistic, which I will show you a little bit later on. Okay, next slide please. Okay, yeah, so here we go. So the case study that I was talking about, so the little 6-year-old had a possible cancer diagnosis, and he really needed it doing on that day. The temperature was too high, so they said, well, can you try and prepare him, Zoe? And I'm like, well, I haven't actually got any prep resources to hand. So I got inventive. Can you just click on the slide, because it should come up with, there you go, thank you. So I basically had a polo mint in my pocket, and I said, right, so this is what the scanner looks like. It's a round circle, it's white, and I just drew on a piece of paper like a bed to demonstrate like the tunnel, and I then accompanied Bob to his scan. He agreed to give it a go. I stayed and talked to him in the control room, and lo and behold, he actually stayed still and he managed it. He had a successful scan and he went home straight away, and his dad was just over the moon that we managed to get it done without an anaesthetic. Next slide please. So what my rationale behind my project was, you know, what is MRI scanxiety? So a lot of children that get referred to me now, they fear being claustrophobic. They also fear that they won't be able to keep still. In fact, actually, that's what a lot of the doctors say. They don't think that kids can stay still. They also fear loud noises. Obviously, the scanner, as you know, is really quite noisy. They worry about being on their own. They think they're going to have to be on their own in there, and actually that's not true. They can have a parent or guardian or carer with them at all times. And some of them fear big machines. Obviously, most of them, the kids that we see, have already gone for X-rays, and you know, they can be scared of big machines. So I wanted to produce something that was realistic, something that they could interact with, and just kind of get used to knowing what exactly is going to happen during their scan. Which is why I came up with the idea of a model MRI scanner, which is what I've made. Next slide, please. So before I demonstrate, obviously I can't demonstrate my actual model physically here today because it's not very easy on the web camera, so I apologize for that. So what I have done is I have done made a quick video explaining what my scanner actually does and the features of it. I will, if I can have the next slide, please. Hopefully this video will work. Thank you. This is going to be noisy. So I think this is the last sound, and then it'll go on. There you go. Lovely, thank you. Next slide, please. Hope that was okay. Right, so future plans. I have so many plans to continue developing my scanner. I would really love to see other hospitals with the scanner. I'm looking to get some funding to manufacture more models. I'd love to be able to go out into other hospitals across the country. When I presented this case over in New Zealand back in 2018, and other people were interested over there of actually buying one. So now we are in a position to actually start manufacturing properly. I'm hoping we'd love to be able to sell a few, or at least just come and do some presentations in other hospitals just to show you what what is out there. I want to design and 3D print the coils that we use during the scans as well. So some children have a helmet on their head with a mirror on it, so they can look through and they can see their parents and what have you. So I want to print one of those, make one of those, and some other coils that we use. What I've really tried to do is publish my results from the data and feedback received over the last 10 years I've been working on this project. And that's proving a little bit difficult right now. I've done a journal, an article for the Nursing Times, but unfortunately they haven't come back to me yet to say if it's been approved yet. So I'm struggling to actually get I've done an article, it's all ready to go, but I haven't got it published yet. So that's what I'm aiming at doing in the very near future. And one thing is really that's come out of doing this, getting this award actually, is somebody found me and said, would I come and inspire children from the age of 10 to teenagers up to 18 at these teen tech conferences. So I go now every 2 or 3 times a year to these big conferences, and I talk to groups of 60 children, 60 teenagers about, you know, how I made my project innovation and why I did it, and it encourages them now to start doing, you know, their own things. So that's really, really exciting. And yeah, I just want to say thank you to Starlight for, there we go, that's my me receiving my award. It was just such a brilliant afternoon, that really was. It'll stay in my memory forever. It was yeah, it was just wonderful. Anyway, I'm going to stop talking now before I get emotional, so thank you.
Thank you, Zoe. That was a brilliant presentation. Amazing to see the video as well. I am aware we're running a bit short on time. We have got one more presentation from Sarah from Hope House Hospice. If anyone is able to stay an extra 5 minutes past 1 o'clock to hear Sarah's full presentation, we'd really appreciate it. It's another amazing innovation to hear about. So over to you, Sarah.
Thank you, and I'll be as quick as I can. So our innovative idea is very different, I suppose, from the ones that have already been up today. So we are a hospice, a children's hospice, that we care for children with life-limiting and life-threatened diseases and health conditions, and a lot of our children have profound and multiple learning difficulties. So one of our ideas that we had was we wanted to use the grounds to give our families the opportunity to access free, accessible, safe and trusting environments with things that they can't necessarily attend outside of the hospice. So this could be from financial reasons, transportation, environment, and feeling alone. So one of our biggest things is our families feeling isolated and not feeling included. So it was about us giving them opportunities to build relationships between themselves and allowing everyone to be thought of, and actually everyone in that family to be number one. So the child itself that we care for, the siblings and the families and the grandparents. So for us, this was about creating a whole memory-making experience so that they can be heard and be listened to and it be all about them. Next slide, please. So some of the ideas that we had, they first came around with our summer fun days, our Easter egg hunts, and then our Winter Wonderland. So our first ever event was actually something that we did was Winter Wonderland, but I'll come back to that one in a moment. So this year, our big summer fun day was all around exercise, activity, and giving children opportunity to do things with their families that if you go to maybe a school fete at a mainstream school or a village fete, that they can't always all be involved in. So as you can see in some of our photos, we had different bocce sets, we had circus activities, and we had activities that were wheelchair friendly and for those that were also mobile, and all of the families were involved. So everything we've done has been fully grant funded. Everything is free for the families, and we made sure that the whole environment and the whole day was covered from beginning to end, including all food, refreshments, and we had it all covered by play staff and volunteers. Now, when I say play staff, us at Hope House, there's only 1.5 of us. So I'm full-time and I have one part-time member. So we cover a 7-day service with just one 37.5 hours and one 22.5 hours. So we rely a lot on volunteers, and we ask volunteers to help. Now, sometimes that's staff that come in on their days off, maybe, but a lot of it is our volunteer team, that some of our local gardeners, our maintenance volunteers, our activities volunteers, and they'll come and provide their time. Next slide, please. So here we also have, you can see the Mr. Whippy van. So this lady came along and she actually gave up a whole day with her ice cream van, and then we got a grant that covered ice creams and every person and every child and family member at the fun day was entitled, they got a voucher and they were entitled to an ice cream. And that might seem really small, but actually some of these families can't afford to do these things. So actually for them, for the family that you can see there in the photo, they actually came away and said, we would never have gone to a summer fun day or a fun day in the village because we wouldn't have the finances to let them be included. We wouldn't have the £1 for this game, or the £1, £2, £3, £4, £5 for an ice cream when I've got 3 children. So for us, we just took all of that stress away. We had people like Animal Encounters come, face painters, magic bubble workers, ukulele bands. Most of these people volunteered their time for free, and anything that we did have to pay for, we applied for grants, so none of the money came out of the hospice funding. Next slide, please. We also run family forest school sessions. So all of our sessions and all of our activities are bookable on Eventbrite for our families that are open to us. So our forest school sessions, both myself and my activity support worker are forest school leaders, trained forest school leaders. So we can run these bookable sessions where children can access our amazing grounds with accessible grounds and paths, so that they can be a part of something that they might not get to be involved in at school or within the community. So as you can see here, actually this young lady that's in the middle, and her mom is sat on the bench next to her. Her baby is 3 weeks old in that sling, and she felt comfortable and confident enough that she knew that we would be able to help care for her child during her forest school session, whilst they weren't just accessing the hospice, and she'd just had a baby. And the other young man that you can see with a big smile on his face, he'd recently just come straight from hospital and hadn't been back to accessing school yet, so was using us as a safe place where he can build up his trust in other adults again and learn to be within groups again. So that's why that dad wanted to book our sessions. And actually it's about giving our parents the time to be together and feel confident in themselves and no longer isolated. Because actually when you have a child with PMLD or a life-limiting condition that quite often have a low immune system and get sick constantly, they become isolated. They can't access things outside of home, really. Next slide, please. And this is our winter wonderland. This is my baby. So this is how it all started a few years ago. I had a family where we get quite often as a hospice get given tickets, and we give them out to families so anybody would like to go. And we had a family that went to a winter wonderland event that was put on outside of us, and they called me up and said, thank you very much for the tickets, but we'd never like those tickets again because it wasn't accessible as they said it was, and we got stuck in the mud, and it has traumatized my child and our whole family. And I was like, right, I'm so sorry. We were told it was accessible. We gave these tickets out. And what can I do to make this different? We've got almost 4 acres of land here at Hope House. So what can we do? So we created our own winter wonderland, to which we have built on it now for the last 4 years. And each year has got bigger and better, but everything needed to be about what our children could see from a sensory point of view, and how tactile it could be, how visual, how confident and comfortable, and about making memories. So many families would never be able to go to Lapland or go to a reindeer farm to see the reindeers. So why not bring them to us? And because our events are open to every family, we make sure that it is accessible now. So that if that means they haven't got transport, then we get a grant and transport them in, so that every family, if they wish to attend, can. So there aren't any restrictions. They can all use our bathroom services, because obviously we've got accessible changing rooms. Everything is done on the child's level. As you can see with our Father Christmas grotto, that's our forest school cabin that volunteers came in and spent 4 days decorating. The tunnel, the light tunnel, that's become more and more advanced throughout the years, and currently is now up in our garden as a Halloween tunnel, which is no longer wooden, it's now a metal tunnel covered in lights, and we have a Halloween trail this year, and everything is accessible. So some parents have said to us that they no longer feel alone because they didn't want to go to these things before because they felt like they were the only one. So they would have try and take their children out, but because they didn't have accessible changing rooms, they felt they couldn't access it for long enough. And not only do the siblings and the grandparents feel heard, some children want to bring their friends because they don't feel ashamed of using a hospice or embarrassed about using a hospice, because this is now a fun place to be. It's not about a medical thing about anymore. It's become fun. It's become where we go to play. Next slide, please. So these are all about quality moments that matter for children and families. So one of the family quotes you can read there is, "We'd never be able to access this altogether without you." Being able to know we can get around all the areas that staff are there to trust, to help us, that we trust, and we get time as a whole family, and everyone is thought of. So this is magical and the most wonderful Christmas we have ever had. And now parents are calling us and asking us when the tickets go live for this year's Winter Wonderland, which is all planned and ready to go. So that's what we've done which was our innovative idea. Thank you.
That's brilliant. Thank you very much, Sarah. Lovely to see a hospice being represented and that inclusivity at the heart of it as well. So thank you so much to all of our speakers today. Apologies for running over time. We haven't had time to open it up to questions. We will let everyone kind of go and get on with your day. But if you do have any questions, burning questions now, pop them in the chat and we will follow up. Just a final piece of admin. We do have another webinar coming up on the 4th of November, 12:30 till 1:30, and this is also about the Health Play Innovation Awards. We'll have a range of our shortlisted applicants coming along, so if you want to hear more innovative pieces of work that were shortlisted, come along to that, and we'll also be launching the 2026 awards. So if you'd like to hear a little bit more about how to apply for next year, come along there. There's a sign up on the screen. It's also on our website. Some of you may have spotted we were running another webinar on the 11th of November about the Play Well Toolkit, which launched this year. Due to various circumstances, we are going to have to postpone that webinar, but anyone who has signed up will let you know a new date, and we'll advertise a new date to everyone shortly. So it's just left for me to say thank you so much for all of the speakers for coming today. A big congratulations for either winning or coming runner-up in our first Health Play Innovation Award. And yeah, have a good day and hope to see some of you at the next webinar as well. Thanks very much, everyone.